What are your alternatives to hysterectomy? Hi, I'm Dr. Shivani Chandan, consultant obstetrician and gynecologist at Aster RV Hospital, JP Nagar. Have you been advised a hysterectomy and wondering if that is the only option? In this video, let me talk to you about the safe, effective alternatives to hysterectomy that you may not be aware of. Firstly, why is a hysterectomy advised? Hysterectomy is usually the procedure in which the uterus is removed. It is advised for situations in which the patient may have heavy menstrual bleeding. You may be having fibroids, adenomyosis, or a condition called endometriosis, or some precancerous conditions, or prolapse. But in many of these conditions, there are less invasive options available other than hysterectomy. Let us look at the various options available. The first option includes medications. These medications can be non-hormonal or hormonal. Medications can be tried in case of heavy menstrual bleeding. This could include something as simple as tranexamic acid or hormonal pills, which will help to reduce the bleeding. These medications can be used even in the perimenopausal phase to control heavy menstrual bleeding. The second option could be a hormonal intrauterine device. Now this is otherwise called Mirena, and it is a small T-shaped device that can be placed into your uterus, and it is an excellent alternative to hysterectomy in cases of heavy menstrual bleeding which otherwise respond to hormonal medications. This Mirena is also an alternative for adenomyosis. The next option could be hysteroscopic procedures. In cases where a patient has a submucous fibroid or a polyp which is causing heavy menstrual bleeding, this can be treated just by a simple hysteroscopic procedure and does not require hysterectomy. There are some more intrauterine endometrial ablative procedures where the endometrium is burnt off or is ablated surgically and can avoid a hysterectomy. This option should not be considered for those who are desirous of fertility. The next procedure is something called a myomectomy. Myomectomy involves surgical removal of the fibroid, or the fibroids are mapped so that they can be surgically removed laparoscopically, and hence hysterectomy can be avoided. There is another procedure called uterine artery embolization, which is done by our radiologist, in which the blood flow to the uterus is cut off. This can be done in case of heavy menstrual bleeding, fibroids, and adenomyosis. So after I have spoken about all the options, you must be wondering, how can we decide? So the decision is taken based on a number of factors which include age, fertility, your symptoms, and whether you're desirous of fertility or not. That is why a second opinion is very important. What may work for one woman may not work for the other, and hence the treatment has to be individualized. Our job as a gynecologist is not just to offer you surgery, it is to give you the best option available. If you have been told that hysterectomy is the only option, don't rush. Come visit our second opinion clinic so that we can discuss what your problem is, what the condition is, and if there are any other alternatives available.